This is Chapter 3, Infection Control, Safety, First Aid, and Personal Wellness. Moving right into infection control. Infection is a condition that results when a microorganism invades the body, multiplies, and causes injury or disease. Microbes include bacteria, fungi, protozoa, and viruses. And a pathogen is a microbe capable of causing disease. Types of infection include communicable, which are able to be spread from person to person. The CDC investigates and controls communicable diseases and epidemics. Nosocomial and healthcare-associated infections, which we've heard about a little bit, HAIs. Infections acquired in hospitals and other healthcare settings caused by infected personnel, patients, visitors, food, drugs, or equipment. Just remember, we can, and sometimes healthcare providers do, a lot of times, cause nosocomial and healthcare-associated infections. So we just need to make sure, and this is why infection control is so important, washing your hands after you are in a patient's room, because a lot of things in there can be contaminated. Anything the patient touches, anything the nurses touch with gloves on and then touch something else with, countertops, keyboards, everything can be contaminated. So just make sure that you're washing hands or hand sanitizing in and out of rooms. Okay, it's very important. This is our biggest defense against these healthcare-associated infections. The chain of infection finds a susceptible host, or a mode of transmission, a portal of entry, a susceptible host, an infectious agent, a reservoir, and a portal of exit. The infectious or causative agent is a pathogenic microbe responsible for causing an infection. The reservoir is the source of the infectious agent, or a place where a microbe can survive and grow or multiply. Includes humans, animals, food, water, soil, and equipment. So just remember, microbes can survive on multiple surfaces, many surfaces. An exit pathway is a way an infectious agent can leave a reservoir host. Includes secretions and exudates, tissue specimens, blood, feces, and urine. This is why it's very important to cover your mouth when you sneeze, cough. Making sure that you're wearing your protective equipment so you don't get blood, feces, or urine on you from someone who might be infected with something. Just making sure that you're taking proper precautions and wearing gloves when you're handling any sort of tissue specimen or anything like that. Means of transmission could be airborne, contact, droplet, vector, or vehicle. So airborne, okay, is when we breathe in the microparticles in the air. Contact can be direct touching or kissing, or indirect touching contaminated objects. Droplets include coughing and sneezing. Vector is an insect, arthropod, or animal. And a vehicle can be food, water, or drugs. Entry pathway is a way of an infectious agent enters a susceptible host. This includes body orifices, mucous membranes, and breaks in the skin. If you have scratches or cuts in the skin, infections can enter through that. They can enter through the mucous membranes of your nose, mouth, and eyes. And then that would be your body orifice as well. Susceptible hosts include someone with a decreased ability to resist infection. And the factors of this include age, health, and immune status. Patients with immunodeficiencies or diseases that have immunodeficiencies, so like cystic fibrosis or oh my goodness. Cystic fibrosis is the only one I can think of right now, but there are quite a few. Just any immunodeficient person, old or young, can be more susceptible. Breaking the chain of infection can be done through hand hygiene, getting nutrition, rest, proper nutrition, proper rest, reducing stress, immunizations, insect and rodent control, isolation procedures, which we'll talk more about, decontamination of surfaces and instruments, disposal of sharps and infectious waste. This is really important, and we play a direct role in this. The use of gloves, gowns, masks, and respirators, we also use these, and these can be really important. And then our needle safety devices, which we play a direct role in as well, and are also very important for our own safety and the safety of the patient. Infection control practices. Hand hygiene is the big one. We've talked about it quite a lot over the last couple of chapters, making sure that we are constantly washing our hands, hand sanitizing in and out of patient rooms, before and after patients, before and after we put gloves on. Using alcohol-based antiseptic hand cleansers, so like hand sanitizer, and washing hands with soap and water. Personal protective equipment, or PPE, that's another abbreviation you need to know. Using gloves, gowns, lab coats, masks, face shields, and goggles, and respirators if necessary. Now, these will only probably be necessary in the hospital settings. If you move on to get a job in the hospital someday, these will be things that you're familiar with. Things like plasma centers, you'll have a lab coat that protects you and your scrubs. You'll be wearing gloves for every patient, and you'll have a face shield. Infection control programs are put in place to break the chain of infection, protect patients, employees, and visitors, institute special precautions in the event of outbreaks. An example of this would be COVID. Components of this include employee screening and immunization, mandating immunizations or vaccines, enforcing masks or PPE to be used, doing employee screenings as employees walk through the door, evaluation and treatment, and then monitoring and collecting data on all infections occurring in the institution. Now, during COVID, this was a big thing. They were monitoring infections like crazy, and there were lots of healthcare-associated infections when COVID happened. But the major hospitals and clinics provided evaluation and treatment for all employees. So that was good. PPE, or personal protective equipment, is really important. It's your greatest defense against these pathogens and microorganisms, infection. Donning and doffing PPE has a specific order. The order for donning PPE, or putting PPE on, is your gown first, then your mask, make sure it covers your nose and your mouth, and then your gloves. Gloves last, just because we don't want to contaminate the gloves that are going to be in contact with the patient when like putting our mask on and touching our hair or touching our face or touching anything. And then the order for doffing PPE, since we've been in contact with a patient and we don't want to contaminate everything else now, is gloves off first, gown off, then mask off. Then you must wash your hands after removing PPE, because the PPE could have come in contact with something in the room as well. So if you don't have gloves on and you're touching your gown or touching the mask that you were wearing, you should definitely absolutely wash your hands with soap and water. Proper contaminated glove removal is something that we'll be practicing as a skill. So we want to make sure that when we're removing our gloves, we pinch the inside of the first glove and slide the glove off of the hand and fingers. That's square B. Square C is balling up the contaminated glove into the palm of the still gloved hand. D is placing one finger underneath the cusp of the glove between the glove and the wrist. So that would be, for example, instead of touching the outside where the contamination is happening, you're just reaching one finger into the cusp of the glove and then sliding it off over the hand with the contaminated glove still inside. So pulling the glove off of the hand and fingers inside out with the first contaminated glove still inside of it, and disposing of gloves in proper trash or biohazard bin. Usually you can just throw them right in the trash can. If they have a lot of like blood or anything on them, they might need to go into a biohazard bin. Each room has one. Isolation precautions can be kind of tricky. They're different for each transmission type. So isolation procedures keep patients with communicable infections separate from others, prevent spread of infection, protect patients with compromised immune systems, and isolation requires a doctor's order. There's usually a piece of paper or a sign on the door that says this person is in XYZ isolation. That means you may not enter without wearing this PPE, this PPE, this PPE. Now, gloves are a standard precaution, so you must wear gloves when contacting with every patient. But isolation precautions are put in place for antibiotic-resistant infections. Well-established antibiotic-resistant bacteria that requires isolation precautions include MRSA, C. difficile, meningitis, pertussis, and COVID-19. So these are kind of all the big ones. Other important ones are going to be things like bed bugs, head lice, scabies, stuff like that. On the reverse side of this, we can also reverse isolate someone who has an immunodeficiency, like cystic fibrosis, and that just protects them from everyone else because they are more susceptible to contracting infection or like the bacteria and pathogens that people carry. Scrubs or other pants that touch the floor can easily pick up infectious material. According to CLSI laboratory safety guidelines, pants worn by laboratory personnel should be 1 to 1.5 inches off the floor to prevent contamination. This is why you see a lot of pants like this nowadays that have the cinched bottoms. If you're going to have a wide leg pant that goes over the top of the shoe, just make sure that it's not dragging or touching on the floor because it can pick up pathogens and you can take that home to your kids, husbands, families, dogs, yourself, whatever, okay? Guidelines for isolation procedures include standard precautions, which are used for all patients every time. It's the #1 strategy for control of nosocomial infection, okay? So isolation precautions is our #1 defense. This covers blood, all body fluids, skin breaks, and mucous membranes. Transmission-based precautions are used for patients known or suspected to have certain infections. There are 3 types: airborne, droplet, or contact. So when I was talking about the signs on the doors, it's going to say airborne, droplet, or contact, and then detail what PPE particularly you need. This is a standard precautions for infection control insert. This should be in your book if you're following along on chapter 3. Assume that every person is potentially infected or colonized with an organism that could be transmitted in the healthcare setting. That means that anytime we enter a room, we are assuming that this patient has some infection or really highly contagious disease that we don't want to get. So we're using our standard precaution. We're always using gloves when we're touching patients, never touching patients without gloves. Always performing hand hygiene in and out of rooms, whether that be using hand sanitizer or hand washing, and then wearing the proper protective equipment. Types of isolation include protective or reverse isolation, which is for patients that are highly susceptible to infections, cystic fibrosis, also patients that are receiving chemotherapy, their immune systems are lowered. Then traditional isolation systems, which are category specific, so contact, droplet, or airborne. And then the disease specific is C. diff, pertussis, or tuberculosis. So it'll always say category specific, this is the isolation that they have, and then this is the disease that they have. Universal precautions are blood and body fluids of all people are considered potentially infectious. Body substance isolation goes beyond just gloves for contacting moist body substances. So if you're working with splashable substances like blood or urine, sometimes sweat, you might consider wearing a gown and a face shield as well, or a face mask, just to protect yourself, because remember, we can get infections and be exposed through the mucous membranes of our eyes. Also breathing things in the mucous membranes of our nose, or potentially getting any sort of body fluid splashed into our mouth. Biosafety. So a biohazard is any material or substance harmful to health, should be identified with a biohazard symbol, which means if we are transporting blood, or if we have a specimen that we are transporting anywhere or taking out of the room or anything like that, it has to be in a biohazard baggie. It is indicated by, it'll be indicated by this symbol, and easily identified as a biohazard so that people know when they're handling it, they need to wear their precautions. Bloodborne pathogens are any infectious microorganism present in blood other than body fluids and tissues. These germs can cause long-lasting infection in the blood and body system. The most frequently occurring lab-acquired infection is hepatitis B. So a lot of people, or the most frequently occurring infection that people get is hepatitis B. The most common exposures for healthcare workers include hepatitis B, which is present in blood and other body fluids, can survive up to a week on objects, can be transmitted via needle sticks, sexual contact, etc. Hepatitis C is present in blood and serum, sometimes saliva. Infection primarily occurs after large or multiple exposures, transmitted via needle sticks and sexual contact. Only about 25% of patients who have HCV will show symptoms, and the symptoms are pretty much the same. Flu-like fatigue, loss of appetite, mild fever, muscle, joint, abdominal pain, nausea, and vomiting. So the symptoms are pretty close to the same give me a second. So hepatitis B and hepatitis C are two of the most commonly acquired infectious diseases from healthcare workers in particular. The best defense is the HBV vaccination. There is no vaccination currently for the HCV. Most employers will require the HBV vaccination as terms for hire. Bloodborne pathogen standards are put in place by OSHA when it was determined that all healthcare workers face serious risk by occupational exposure to blood, other body fluids, and tissue. Bloodborne pathogen standards are enforced by federal law. They're intended to reduce or eliminate occupational exposure to bloodborne pathogens. It requires the use of engineering and work practice controls to prevent exposure incidents, the availability and use of PPE, special training in the use of all PPE, and availability of vaccination against HBV for all at-risk personnel. So this just means that the workplace will require the HBV vaccination. They will also provide it for free to employees or recently hired employees if they don't have it. They will be required to have PPE at all times available to be used in the purpose of employees protecting themselves from bloodborne pathogens. And there is training on how to use the PPE in the workplace setting. So there's specific masks and things that you have to go in and get fitted for. You go into a fitting test, and then also respirators. They go in, they show you how to use the equipment properly, make sure everything is hooked up correctly. You get fitted for a respirator mask if that's something that you'll need for a procedure. And then once you have the training, you get a special little sticker on your badge or in your file that shows you've completed the PPE training and you're now allowed to use that specific PPE. Because of these standards, occupational acquired hepatitis B has declined since it was put into place. Biohazard exposure routes include airborne, inhaled when splashes, aerosols, or fumes are generated. Ingestion, poor hand hygiene before handling food, drinks, or gum after using the restroom. Percutaneous, the skin is pierced by a contaminated needle or sharp object. This one is going to be the one that is the greatest danger to us as phlebotomists, and it is the most common way that phlebotomists acquire healthcare-related infections or healthcare-acquired infections, bloodborne pathogens, is secondary needle pokes. Premucosal, blood or other body fluid splashes in eyes, nose, or mouth. Non-intact skin, blood or other body fluid contacts, cut, scratch, or abrasion, or a human bite breaks the skin. Now, the human bite is concerning sometimes, but not every patient is looking to bite you. Just be aware that there are some patients, we do have like psych wards in the hospital and things where patients are confused, or maybe they're on like heavy medications or anything like that. Whatever the situation may be, there's always a potential for negative patient contact where a patient can harm you. So just be aware of your surroundings, be aware of the patient and their actions, and do your best to try not to, especially if it's an aggravated situation, let the patient come between you and the door, and let them advance on you. If you're in a room alone, make sure that you are in a safe environment. Exposure incident procedures, and this will be specifically for like a needle stick or other sharps injury. So this is what you do if you get a secondary poke. Carefully remove, in this case it wouldn't be the shards of glass, it would be the needle. So carefully remove the needle from the site where you have been stabbed or poked. Make sure that you safety it. Then wash the site with soap and water for at least 30 seconds. If you get something splashed into your eyes, then you're going to flush the site with water or sterile saline for at least 10 minutes. Use the eye wash station if available. Remove contact lenses as soon as possible and disinfect them. After you have removed the object and washed the site or rinsed the site, so your eyes, nose, or mouth, you're going to report the incident to your supervisor immediately and then report directly to provider for evaluation, treatment, and counseling. So just remember, we're dealing with bloodborne pathogens here, and standard precaution says that every person you come in contact with potentially has transmittable disease, and so you want to protect yourself. If you get a needle poke or exposure to body fluids in your eyes, nose, or mouth, you want to go to the emergency room as soon as you can, have a blood test drawn, and then if you need counseling after that, the hospital will provide. Surface decontamination is really important and required by OSHA. We need to decontaminate surfaces, especially so like in outpatient settings or even plasma centers, right? So like a patient comes, goes through the procedure, the patient leaves, we decontaminate everything, we wipe everything down, the bed and stuff, so that we can bring a new patient in and they're not subject to transmissible diseases. All surfaces and specimen collection and processing areas must be cleaned with a 1 to 10 bleach solution or other disinfectant approved by the EPA, Environmental Protection Agency. The cleanup of body fluid spills must use an EPA-approved chemical solution and kit. Gloves must be worn, absorb material without spreading it over a wider area. So there are kits for blood and body fluid spills that use a substance to absorb the liquid or the material that's spilled. So something like a cat litter or absorbent material. You sprinkle it over the top, and then typically it'll come with, so the whole kit will come with gloves, absorbent material, and then cleanup supplies like paper towels or napkins, or like a little broom and dustpan so you can clean everything up. Biohazard waste disposal. All non-reusable items contaminated with blood or body fluids go in biohazard waste containers. They're big red containers that have the biohazard symbol on them, and they are taken and incinerated. That's how we get rid of the biohazard waste. Going really quickly into electrical safety. If electrical shock occurs, shut off the source of electricity if you can, or use non-conducting items to remove the source of electricity from the victim. Call for medical assistance. Start cardiopulmonary resuscitation or CPR if needed, and keep the victim warm as to combat shock. One thing with this is just to make sure that you're not placing yourself in harm's way. So if there's something exposed that's electrocuting a victim and you go to touch it and get electrocuted, that's not going to help anyone. So just remember that you need to turn off the electricity first or use something non-conducting to get the source of electricity away from the victim before you start any care. Okay? Personal safety is a priority as well. Fire safety. For fires to occur, there needs to be 4 components: fuel, heat, oxygen, and a chemical reaction. The best way to prevent a fire is to keep these components apart. So our fuel is a combustible material. Heat raises the temperature of the material until the ignition. Oxygen maintains combustion because a fire needs oxygen to burn, right? And then a chemical reaction produces the fire. So if we can keep these apart, then we can prevent fires from happening. As an employee of any job, you should know the procedures to follow in case of a fire, the location of fire extinguishers and how to use them, the location of fire blankets or heavy towels and how to use them, and the location of emergency exits and evacuation routes. In large hospitals, there should be pictures posted for evacuation routes. Sometimes plasma centers will have them too, depending on their size, but usually plasma centers only have a couple of doors. You go out the front or you go out the back. Hospitals can be a little bit more tricky because it's multiple floors, multiple staircases, multiple elevators, multiple patients, okay? And as an employee, typically your job is to get all the patients out first. So just make sure you know the policies and procedures. Also, make sure you know where the fire alarms are located in case something happens and you need to pull it. Okay? Fire classes include A, B, C, D, and K. Class A is ordinary combustible materials, which include wood and paper, that require water or water-based solutions to extinguish. Class B is flammable liquids and vapors, paint, oil, grease, gas, require a blocking oxygen or smothering to extinguish. Water won't work. The same as it would for a Class A fire. Class C is electrical equipment, requires non-conducting agents to extinguish. Class D is combustible or reactive metals. Sodium, potassium, magnesium, lithium require dry powder agents or sand to extinguish. And then Class K is high temperature cooking oils, grease, or fats. They require agents that prevent splashing and cool and smother a fire. Radiation safety. The principles of radiation exposure are distance, shielding, and time. Radiation is present in patients injected with radioactive dyes, specimens from radiology or nuclear medicine, and the radioimmunoassay area. So you cannot go into the radiology department, and sometimes maybe you would get called in for a blood draw there. But in order to go into the radiology department, there are special trainings you have to do and rules you have to follow. Because the potential for radiation exposure is much higher, obviously, when you go down into the department itself. But there are also special rules for when a patient has undergone radiation. There's a certain amount of time where you can't come in contact with them, or you need a shield, which is, I don't know if any of you have ever gotten an x-ray, but they put the big shield over themselves to protect from the radiation. It's like a big plastic vest type of thing. So there are shields and things that you can use to shield your body, your head. But there are specific rules for coming into contact with patients and specimens that have been exposed to radiation. The longer the time has been since they received the radiation treatment, the less likely you are to be exposed to it. So, moving into chemical safety, there are general rules when working with chemicals. Make sure you're always wearing your PPE and make sure you're always cleaning up your chemical spills properly. So making sure you're using the correct spill cleanup kit. Never store chemicals above eye level, because if you're reaching up to get the chemical down and for some reason you drop it, that can be very dangerous. Never add water to acid, and there's specific rules and all of this, we've seen in chemistry classes and stuff like that. But there's specific rules when working with chemicals. There are chemical reactions that happen that can be dangerous. So just never add water to acid. Do not indiscriminately mix chemicals together. So if you don't know what the chemicals are, or if you have a dirty beaker or a dirty container with a chemical in it. Don't just add random things in because that could cause a reaction. Don't store chemicals in unlabeled containers. You always want to know what the chemicals are. Don't pour chemicals into dirty containers, and then don't use chemicals in ways they were not intended. So just make sure you're following the rules and procedures for each specific chemical, and there are safety data sheets that have specific chemicals, their rules, instructions for using them, instructions for disposal, things like that. OSHA, HAZCOM, Hazard Communication Standards, are the standards set in place by OSHA for labeling and determining what chemicals are in which containers. So the HAZCOM labeling requirements are a statement of warning, statement of hazard, precautions to eliminate risk, and first aid measures for spills or other exposure. So each container that contains chemicals will have all 4 of these labeling requirements, and then a safety data sheet to go along with it. So the safety data sheet contains general and precautionary information about the hazards to users. They're required in each lab. There's a safety data sheet for each specific chemical. They're located in the safety data sheet books and also on the computer. And you should never use a chemical without reading the SDS, safety data sheet, or without proper training for the specific chemical. So when working with chemicals, the best practice is to pull the safety data sheet out, lay it on the counter, and follow the instructions based on what you're reading on the safety data sheet for the chemical that you're using. That way you have everything in front of you. If anything happens, it's right there. You can refer to it if a spill or contact or anything happens. These are visual examples of the labeling system. So we have our hazard class symbol for fire, colored background that indicates a hazard number, and then identification number. Safety showers and eye wash stations. Make sure you know the location of your safety showers and eye wash stations just in case something happens and you need to use them. Each lab, outpatient, nurses station should have an eye wash station at least. These are used for chemical spill or splash to the eyes and body. Flush affected part with water at least 10 minutes. Visit ER for evaluation, and then follow up with employee health. So that would be getting your test results and potentially receiving therapy. This is an example of a spill cleanup kit. So you have gloves there, goggles, super absorbent material, and then broom and dustpan. And then once you scoop up everything in the broom and dustpan, you put it all back in this yellow bag and dispose of it properly. Moving on to personal wellness. So this is more about you now as an employee. It's not just about what we eat. It's a whole mixture of things. And remember, we kind of talked about how things are a balance. In the past, in history of phlebotomy, it's all about a balance of humors. Well, this is kind of more a balance of all of the things that kind of encompass a holistic approach. So one that meets the physical, emotional, social, spiritual, and economic needs. It's kind of an all-encompassing approach to personal health. So personal hygiene is part of this. Make sure that we're not wearing heavily scented lotions or colognes. Proper nutrition, make sure you're eating a well-balanced meal, fruits, veggies, meats if you eat meat. Get great rest and exercise. Lack of rest and sleep can lead to fatigue and other medical problems. It would be great if we could all get 8 hours of sleep or more a night. Sometimes it's just not feasible. So just do your best and try to get as much rest as you can. Rest is when your body repairs itself. Back protection. Use proper lifting techniques. Make sure you're lifting with your legs and not your back. Also, as phlebotomists, it's very important that you raise hospital beds. Okay? If you're bending down like this to draw blood all day, it's really going to hurt your back. So make sure you're raising the bed so that you can reach your patient efficiently and not hurting yourself. Okay? It's not worth it. And then managing stress. Find an outlet, because sometimes, especially in the healthcare setting and hospitals, things can be pretty stressful. So if you don't have an outlet for stress, like it could be anything, cooking, drawing, hiking, walking, fishing, Anything that you can think of that makes you happy, that is an outlet for stress, try to have a hobby, okay? Because healthcare can be stressful and overwhelming, and it can kind of take an emotional toll sometimes, okay? So just keep that in mind. It's an all-encompassing approach to personal health, and we just need to make sure that we are well-balanced and as well-balanced as we can be in all of these areas. Healthcare workers are at risk for back injury because of activities they are required to do. Example, bending all day to drop patients, and because of the stressful environment often associated with healthcare today. First aid is the ability to recognize and react quickly and skillfully to emergency situations. This may mean the difference between life and death for a victim. This is about to be a very fast overview of CPR. If you don't have CPR, don't worry, we'll get you CPR before you're graduated, and it's included in the course, so we'll just make sure that we get your CPR certification so that you can go through the fully in-depth course and learn how. To start, we'll talk about external hemorrhaging or profuse bleeding. The best treatment for this is direct, firm pressure on the site of the bleed using cloth or gauze. You can use a t-shirt, you can use towels, whatever you have. An elastic bandage can be used to hold a compress in place only once the bleeding has stopped. If the bleeding hasn't stopped, it's not going to provide enough pressure yet. You have to hold manual pressure until the bleeding has stopped. Then you can look at applying an elastic bandage. Only use a tourniquet as a last resort. So if the bleeding just won't stop, you're just putting more and more and more gauze on, more and more pressure, and the bleeding will not stop, we're gonna put a tourniquet on. It looks like we've got an arm and a leg on this picture, but here this is a picture. So we've got bleeding down on the calf area here. If that's happening, we're gonna go up as high as we can, closest to the heart as we can, and I guess you can just go right above the joint here. So don't do it over the joint, do it over the knee, but we're gonna go up closer to the heart, okay? And then we're gonna put that tourniquet on as tight as we can, and then we're gonna secure it and put the time on it so we know when it was placed. Once the tourniquet is in place, don't take it off. Leave the tourniquet on. Healthcare providers will assess it and take it off later if need be. Shock is something that you'll see or might see in the form of a vasovagal response with patients. So people will pass out. Shock can be associated with losing a lot of blood. So shock is a condition involving insufficient return of blood to the heart, results in inadequate supply of oxygen to body organs and tissues, caused by hemorrhage, heart attack, trauma, and drug reactions. If you come in contact with someone who's experiencing shock, they might have pale, cold, clammy skin, a rapid, weak pulse, increased shallow breathing rate, or an expressionless face and staring eyes. Make sure they have a good airway. Even if they can't respond to you, just make sure that they can breathe on their own. Call for assistance, so call 911. Keep victim lying down with head lower than the rest of the body, so that just means elevate the feet a little bit. Control bleeding or other cause of shock, and keep victim warm until help arrives. So first aid for shock includes maintaining an open airway, just make sure they can breathe on their own. Calling for help, so call 911. Keeping the victim lying down with the head lower than the rest of the body, so this just means laying them on their back and elevating their feet. This helps with blood return. Control bleeding or other cause of shock, and keep victim warm until help arrives. CPR and emergency cardiovascular care. The training recommended by AHA for healthcare professionals is a 6 to 8 hour basic life-saving healthcare provider course. This includes CPR, use of an AED, removing airway obstructions, and the certification is good for 2 years. And again, we'll put you through that certification course if you need it. AHA CPR and ECC guideline updates include hands-only CPR for lay people, so people who aren't associated with healthcare, who maybe have never had training. A lay person can do hands-only CPR because they don't know how to deliver breaths correctly or what they would be looking for. 100 to 100 compressions per minute. Infant and child compression depth of 1/2. Anterior, posterior chest diameter. and adults would be 2 inches. Okay, so infant compression depth of 1.5 inches, and adult and child compression depth of 2 inches. Allow complete chest recoil between compressions, and this allows for the heart to refill fully with blood so that the next compression perfuses the body accurately. Try to minimize interruptions in chest compressions to less than 10 seconds. So if you are doing your 30 compressions, right, 30 compressions to 2 breaths, you're doing your 2 breaths within 10 seconds and then back on the chest for more compressions. Compressions are the most important thing. They're the highest priority. Perfusion is important, so we want to make sure that we are minimizing interruptions in chest compressions. And then avoid excessive ventilation, so make sure that you're just watching for the chest to rise when you're delivering a breath. Depending on the size of the person, you may need to deliver more breath or less breath when you're dealing with infants, children, and adults. The AHA chain of survival is immediate recognition of cardiac arrest and activation of the emergency response system, so calling 911. Early CPR with emphasis on chest compression. Chest compressions are the most important thing. Rapid defibrillation, getting a defibrillator as soon as you can. If one's not available, just continue compressions until help arrives. Effective advanced life support and integrated post-cardiac arrest care, which happen in the hospital setting, and the healthcare providers do that. So that is chapter 3. If you have any questions, please reach out and let me know.